Today I'd like to take the time to talk to you a little bit about imaging. What do I mean by imaging? Well, things like x-rays, ultrasound scans, MRI scans. Lots of people have heard of these things, lots of people have had these things before, but the decision to have a scan or imaging or not have them is quite a difficult one to answer. It's going to take more than the content of this video to kind of cover everything to do with it, but I just want to give you a little bit of an insight into the world of imaging, why it's needed and why it might not be needed. So there is this misconception that some people have that you need to have a scan to have an accurate diagnosis of what's going on. Now, that's not necessarily always true, and in the majority of cases, you can get a diagnosis just by the simple pattern recognition of how did this start, what caused this to come on, how is it behaving. That's why in all of our appointments we always start off with a big detailed interview about tell me about you, tell me about how this all started, because that element of it is the gold standard in diagnosis for the vast majority of musculoskeletal conditions. Obviously we marry that up with an objective hands-on assessment and having a look at how things are from there and seeing how things respond to treatment, but having an x-ray or an MRI or an ultrasound can be overkill in the early stages of things, and it's not usually needed for a diagnosis. In fact, I've heard stories about people having severe muscle tendon ruptures and consultants being like, I'm just booking you for surgery, I don't need a scan, I know you've ruptured this as well. So it's not always needed for every single diagnosis. So physios aren't necessarily against imaging. It is very useful in very specific circumstances, but you have to know the specific circumstances to know when it's going to be useful as well. I recently made a video talking about this before when I talked about ankle conditions and saying if you sprain your ankle really badly, you can't put weight through it, taking more than 4 steps, severe pain and things like that, it probably is worth getting an x-ray, but it's worth considering what imaging you have under what circumstances. So anything bone related, x-rays are usually quite useful for it. If you're looking at more superficial soft tissue, ultrasound can be useful, and if you want to look at more deeper structures, MRIs can be really useful, but even that is a generalization. It's one of those things where different conditions will need different imaging. I'm not expecting you to know the ins and outs of all of that, but that's why we always have that discussion about how things look, whether we need to image, whether we don't need to image from there as well. So often when we have these conversations with patients, they'll say things like, well, why don't we just send for an MRI anyway? What's the worst that could happen? The downside to this is there are actually some detrimental things that can occur because of the imaging as well. One of them is something called VOMIT, an acronym that stands for Victim of Medical Imaging Technology. And the reason for this is, as you're probably aware, there are signs that we get older, grey hair and wrinkles externally, but there are changes that occur internally. There's a long list of things that are labelled as degenerative changes, which is a fancy way of saying as we get older our bodies adapt, as we get older our bodies change. Now, on this long list of conditions, and I'm not going to get into all of them because I'll be here all day, when people report them, if you have an x-ray, you have an MRI, and you tell people what these things are, on paper, they sound terrifying. Things like, oh, you've got a mild disc bulge, or you've got some slight arthritis here and there, and things like that. People get very worried about it, they get very concerned about it, but we know these things can occur in people with no pain, no conditions, and that it's perfectly safe to keep doing what you're doing. That's not always put forward, and people usually hear these, take it verbatim and think, well, I need to stop doing this or this or this because I don't want to make these things worse, when that's the last thing you should be doing. As we get older, we should be maintaining a good level of activity and exercise, and that information can be detrimental to it with getting people to be very paranoid and make their world a bit smaller. In addition to that, if you do have pain and you feel that you get told you have these things, some people can label these things, well, that's the reason why I've got the pain, when we know full well that actually these things probably aren't related to your pain at all. It's just a sign that you've reached a certain age and this has naturally occurred from there. This is the reason why when you have any imaging, they usually really take the time to go through and explain these things thoroughly to make sure you need to be, whether these are things that we do need to address or that we don't need to address, but that's not always articulated well in the appointment. So this is another reason why having imaging can open a big can of worms. So I hope you found this video useful. As I said at the beginning, it's just skimming the surface of it. Obviously, if you do have an injury, if you are suffering with pain, don't use this to guide whether you should or shouldn't get an image with it. It is very individualized based on the situation. But if you are suffering with anything, any aches or pains anywhere, don't hesitate to give us a call and we'll see how we can help. Thank you. Take care.